Well, on to our big focus this morning. Lieutenant Governor Anil Baijal will be chairing a meeting of Delhi's Disaster Management Authority after 12:30 today to deliberate on whether or not COVID restrictions in the national capital can be eased to some extent or not. Delhi's Chief Minister will also be part of that meeting. This comes amid several demands to lift the weekend curfew, the odd-even rule of opening shops, but perhaps most of all, the reopening of schools. Now, Delhi's Deputy Chief Minister Manish Sisodia has already said the Delhi government is actually going to recommend schools be reopened. He's also stressed how it's now become necessary to prevent further damage to the social and emotional well-being of children, and for that reopening schools is absolutely necessary. A delegation of parents has also met with the Delhi government. Some of them are also going to be joining us on the program today. Well, let's in fact take this across to them straight away. We have with us this morning Dr. Chandrakant Leharia, an epidemiologist and health systems specialist, and he was part of that delegation that visited the Delhi government with this petition to reopen schools. Dr. Neetu Talwar, senior consultant pediatric pulmonology with Fortis Memorial Research Institute in Gurugram, is also with us this morning, as is Richa Kapoor, a parent, and Dr. Preeti Ojha, principal of Delhi's International School, Tanya Agarwal, another parent and a petitioner who went to meet the Deputy Chief Minister of Delhi, is also with us this morning. Thank you all for making the time to be here. And this is, of course, something that we must talk about and highlight at a time when a very key decision could be taken today itself. Dr. Chandrakant Leharia, let me come to you first. 1,600 petitions, 1,600 parents, pardon me, feeling strongly enough about this to take a joint petition to the Delhi government wanting schools to be reopened. What is your view at this point? Why do you feel it's imperative that schools must now reopen for children?
So what we need to remember that it is 2 years, and in 2 years we have learned enough about the SARS-CoV-2 and its impact on the children. What we know, and that's unequivocal, that children do develop infection, but they do not develop severe disease, hospitalization. In fact, children are very much protected after natural infection. We know in Delhi, 82% of the children as part of the Sero survey were found to have infection, but very few develop serious disease. Mostly those children who who have some pre-existing condition are at higher risk. Then we also need to remember that the learning loss in this period has been really immense. For 2 years, children have not been to the school, especially those in the early class age children. They have not even started on their schooling. And we know that children who are in the pre-primary and primary require more personalized touch. They need to interact with the students to learn all of this. Two important things are there. UNICEF and UNESCO had said that schools are safe and they do not increase risk of transmission in the community. Then vaccination is not a prerequisite for opening the school. So there is enough evidence, including in the Omicron wave, which is going on around the world, including India. Children have got infection, but there is no report that children have developed severe disease. South Africa, where Omicron wave started, the wave is already over and the schools are open there. In UK, United States, all the places, wherever we are seeing the cases, schools are open and there is no report that children are getting severe disease. Including in India, we know that Omicron wave is going on. Delta infection was high. There is no report of children. So opening school is completely safe. We cannot delay school opening anymore. And in this context, Ms. Tanya Agarwal, who is on this program, she started this petition where she talked to the parents and got these signature.
Yeah.
And majority of parents we have contacted and talked to, they say that they are willing to send their wards to the schools. So schools should be open because it's scientifically correct. Parents want to send their children to the school, and India cannot afford to have that kind of learning loss and suffer our younger generation for even a single day anymore.
Not even for a single day anymore. Tanya Agarwal, you've been spearheading this campaign to get children back into schools. Now, what is the demand? Is it that, every child now needs to be back in school, irrespective of their age or their vaccination status? The fact that Delhi has really missed out perhaps on more school than, anybody else, because in between we've had the schools shut down for pollution and air quality reasons also. And then, of course, for all the COVID restrictions that have been in place, has it just been far too long away from school for children?
Yes, absolutely. It's been far too long. And I think the reason that parents have had to organize themselves, and we've been raising this issue for months, because there is no other voice for our children. Every other sector has a lobby. There's a lobby for the traders, for the shops, for the exhibitions, for the restaurants. But for our kids, there's nobody. Nobody's speaking up. And so we have to speak for our kids. And this 2-year period is a clear violation of their rights. We are far behind the rest of the world. As per UNESCO's own world rankings, in November, we were number 2 in the world behind Uganda. Uganda opened schools on the 10th of January. Are we sensible, or are we, I don't know, stupid? Because why are we lagging the rest of the world? Why are our kids falling behind? Why are our kids suffering severe physical, mental health effects of school closures? Why are our kids suffering learning loss when kids, as Dr. Leheria has very well explained, are at least risk of COVID, but in our country face the maximum restrictions? If you look at July to December last year, everything else was open except schools. Now tell me, what scientific sense does that make? Do adults not bring infection home? They do. Do kids not go elsewhere? They do. And to your question, I mean, every family has a personal risk assessment, but for many of us, that risk assessment is now clearly in favor of opening schools.
Okay.
We closed schools in 2020. We didn't know much about the
benefit
disease.
analysis, kids need to be back in school. We take your point completely. Richa Kapoor, would you say you agree with Tanya Agarwal? This comes at a time when, once again, we're actually seeing Delhi report close to 7,500 cases a day. In the previous 24-hour period, there's been a 24% jump in cases again. So it's not as though COVID is over, or this Omicron variant powered wave is over. But do you believe that perhaps now, the risks of children being away from school really outweigh the risk that COVID poses?
So good morning. Thank you for having me, first of all. And I couldn't agree more with Tanya and also our experts. I think we've spent 2 very long years, and I think the losses which they are suffering is probably farther and deeper, wider than what I as a parent can even comprehend. And I think, like, for example, my own little one, he's forayed into grade 1 without experiencing what kindergarten is. He doesn't know the quintessential things. And I think the learning losses for most of the kids are really bad. I think I, as a parent, now have the onus to reinforce COVID appropriate behavior in my children. And I think it's time to move. It's not going anywhere. We cannot suffer more than this.
Right. Dr. Neetu Talwar, what are the risks at this point? Obviously, we're looking at an older age group of children that have been vaccinated. They're the ones who are going to be facing board exams and so on. So clearly, I'm leaving them outside the equation for now. For all other children, the risks for kids is clearly lower. And this argument about kids taking COVID back to their homes, where there are more vulnerable people perhaps in the family. Is this something that has really sort of outlived its use, given how harmful this has been for children to be away from school for so long?
A few points from the medical perspective. And whenever we are looking at, we are looking at a pandemic in its face, and we have very little data about the long-term repercussions which it is going to have on everybody, including children, which definitely are a vulnerable group. Now, secondly, I've been hearing the other members speaking. So we have been through the first wave. We have seen that the second wave was a disaster, and we are in the midst of the third wave. So whenever we are talking about anything, we have to, we have to weigh the risk versus the benefit ratio. So let us look at the benefit. Benefit, all of you know the psychological effect and the studies and the play and the nutritional, the obesity, all that. But I would like to highlight upon the risks, and are we actually prepared to take this risk? So whenever we are talking about children, the schools reopening and the children going back, we are talking about something which is probably called as a super spreader event. Now, the others, many people are saying that the markets are open, the restaurants are open, and there is, the life which is going on is normal outside. But, whenever we are talking about the school, we are talking about a sustained prolonged period of exposure where the child is going to be in a closed or a confined space for a prolonged amount of time. Now, the second point is, as adults, we understand and we follow the COVID protocols, but do we expect the same 100% from a child? I mean, after all, they're children. They want to run around, they want to play around, they want to, hug each other. So, the third point I would like to make is that even above the age of 15 years in Delhi, the vaccination coverage as per data is hardly around 65%. It is not 100%. So the younger children are not vaccinated at all. So whenever we're talking about an intermingling of a susceptible group with an infected group, okay? So what happens is the exposure happens. There could be several viral mutations and there could be a whole new strain. So the first wave was quiet and the second wave was a disaster. So in case we take some decision, are we prepared for a third or for a fourth very bad wave? So, and the other thing is, do we have the medical infrastructure in the schools, in the hospitals to look after these children? After all, there are infections, there are comorbid conditions in the children also. So if there is a mutation and a new strain, then the vaccinations also don't work.
Okay,
so
Dr. Talwar, you raise some sort of, important issues and perhaps troubling ones. Let me take some of those across to Dr. Preeti Ojha, who's a principal with the Delhi International School. And, these are very specific concerns that the doctor on the show raises. She's talking about the fact that, yes, people are going places, markets are open. But, when you're outside in an open air situation, there is no prolonged contact as there would be in a classroom full of children. Also, how do you police children? It's all very well to say, yes, we'll have protocols in place and there will be masking all the time, but especially with younger children, how do you prevent them, especially if they're seeing their friends for the first time in 2 years? Are they not going to hug? Are they not going to sort of sit together, play together, share their lunches with each other? How is all of that then really going to happen on the ground? Dr. Preeti Ojha.
Thank you so much, and I'm extremely happy that NDTV has come with such a wonderful program. I'm so glad to see our parents over here who seem to be enthusiastic and are actually trying to gather the courage for the parents around who have this thought that how to send the children back to schools. As the doctor has just now told us that there are so many other things that one has to take in mind, all schools have been prepared to make sure that we can take care of children. We are making sure that the number of children in the classroom are less, and it starts from the gate itself. The first thing is the consent of the parent. The second is the temperature that we take. The line movement of the child is all the time being taken care by the teachers along with them. The orientation of the parents has been excellent with the children. For a few days when the schools were open for grade 9 to 12, we could witness the children independently taking their care, and they were making sure that they were not sharing tiffin at all. They were not even getting a lot of stuff to eat. Most of the time, they were taking precaution of not even going together in a group to the washroom. And these were the things which we witnessed, we observed. It's not every time that you keep policing the children. You need to orient the children from home itself. And we gathered so much of information from the parents that children themselves now want to come to school. So that willingness is making them make sure that they're following all the protocols. We have cameras all around, we have recordings, we have everybody making sure, even the teacher is modeling herself how to behave in the classroom. That makes a lot of difference. And all the children don't come to the school together. There are phases in which the children are coming. Even if 9 to 12 opens, it's not that the whole 12th, whole 9th, all the classes come together. We can make a timetable where only 50% of the children are in the school. We make sure the activities that we are generating with the children are of a kind where they're not touching each other. And the most important thing, which I would like to take half a minute for, the COVID when came in the first phase had a different kind of an impact. Second phase, definitely. Third phase, the COVID impact is different. And we all are understanding that what kind of an impact it is. Children were waiting and the parents were waiting for one way how to make sure our children are safe. And we now have a vaccination. We are making sure that children are getting vaccinated. Public school children are 85% vaccinated as per the newspaper data that I saw in the morning. 55 to 60% are in private schools, and there is a need of promoting this courage among the parents to allow the children to get vaccinated.
Okay, fair enough. That's very comprehensive. Dr. Laharia, quick last comments from you. Do you think enough checks and balances can be built into the system so that schools can reopen safely? Or as Dr. Neetu Talwar says, we still don't know enough about the long-term effects this virus might have or further variants of the virus may have on children. So there is that element of risk, but do we then move forward even with that risk taken into account?
What we need to remember that this is not the time to bring in personal opinion in the decision making, and the scientific evidence should be used for decision making, which is very clear. Based upon comprehensive review of evidence, the Indian Academy of Pediatrics, the Indian Association of Preventive Social Medicine, both of these professional associations had said that schools are safe to open. That's one. Second thing, we need to remember that we definitely need to delink vaccination from school opening. World over, schools are open and vaccination of children is not happening. So 15 to 17 years old are in India being vaccinated, but that does not mean that only vaccinated can attend school. So we need to delink. Third thing is that schools are safe, and especially only two things need to be given attention. One is the ventilation of school. You improve the ventilation, but we need to remember that the rules for school children are very different. All children like younger than 5 need not to wear mask. 5 to 12 can wear mask as much as possible. The physical distancing rules are very different for children. So it is safe based upon scientific evidence. In fact, I want to bring in that the Director General of Indian Council of Medical Research had said that schools for primary school going children should be opened first. So in fact, all the states should open school and should open school for all the classes, should delink from the vaccination. And that is what scientific evidence is, that we cannot apply the rules or understanding of March or April 2020 in January 2022. It is time to open school, and please, everyone should read science, not follow the WhatsApp follow-up or social media. Right. Go by the science, and science says schools can be safe to open.
All right. Thank you all very much indeed. Very strong opinions from all stakeholders on the show today. Well, we'll know one way or another perhaps this afternoon after that meeting of Delhi's Disaster Management Authority for kids. The reopening of schools probably can't come soon enough.